On this Pride Month, we're taking a look at the Corewell Health program that helps members of the LGBTQIA+ community find care.
Maine News 8's Kyle Mitchell is here in studio to explain how it helps.
Rick and Emily, finding a doctor with the knowledge to serve the LGBTQIA+ community can be a challenge, but Corewell's patient navigator is trying to make that process easier.
You might find that they don't really understand what a transgender person is. We're given a lot of misinformation about who trans people are, and that can inform how people treat you.
Mazarita found her doctor with the help of a patient navigator at Corewell Health.
Finding somebody who has been educated on the subject and knows about the intricacies of our care is important to making sure that our health needs are met. The Health Navigator tool is useful because it kind of cuts out a lot of that need to do large amounts of research.
She had previously experienced doctors who didn't have the knowledge to treat her or who didn't know how to communicate appropriately.
Well, that doctor had been asking about my family and how supportive they were and just invasive things.
Corewell Health is the only healthcare system in the state with an LGBTQIA+ patient navigator.
We know that this is a marginalized community inside and outside of healthcare that faces harassment, faces discrimination. And our goal at Corewell was to try to break down some of these barriers.
Chris Palazzo is May's doctor and is part of the team working to improve access to care.
Part of that started with the idea of developing a patient navigator who's a live person that you can interact with and talk to and get you to the providers that can ultimately give you the best care.
He has years of specialized training and acknowledges shortfalls among some doctors.
There are people that are still having negative experiences, still being denied care for either their gender identity or their sexual orientation, or they're just not getting the appropriate care.
While May sees the patient navigator as a positive step, she wants to see mandatory training requirements for healthcare systems.
And if they haven't had these trainings or our identities were not reflected in their education, then our access to care will be heavily limited.
If you want to learn more about Corewell's patient navigator, we've included a link in this story on woodtv.com. Rick.